Hey, welcome to the Hank Cisco Show. Ladies, hey, don't touch that dial. We got a great show here. You want to pick up the phone and call your gumas and gumbas and tell them I have a surgeon, a breast surgeon here. We're going to talk about breast cancer, and so it's very important. You heard of doctors don't make house calls. Well, we have a doctor making a house call. Come right into your house and listen, okay? Just stop what you're doing, put the sweeper down and sit down and relax. Okay, and my guest today is Dr., I'm going to announce you like they're doing Madison Square Garden, Dr.
Lori Chaplesky.
All right, and you are a surgeon.
That's right. That's right.
You know,
I'm a breast surgeon. That's right. The
breast
shiny
surgeon.
steel.
Right.
You got
and
it.
You work out of?
I work at Mercy Suburban Hospital.
It's right in East
Norristown.
Norton.
That's
Okay.
right. Mm-hmm.
And tell me something about yourself.
Well, I'm a Pennsylvania girl. I was born and raised in Allentown, Pennsylvania, and I went to college at Penn State. I did my medical school at Philadelphia College of Osteopathic Medicine, and I live currently in Montclair, which is not far away, just close to Phoenixville. That's exactly right. And I did my internship and residency after medical school at Mercy Suburban Hospital.
You're in Suburban.
That's right. That's right.
Well, I have something in common with Suburban. My first daughter was married. My first daughter was born in Riverview Hospital, was on Sandy Street. Now they closed that down and they moved where you're at now.
That's right.
It was Suburban Hospital. Now it's Mercy Suburban. But my first bambino, Joanne, was born there. In fact, my wife said, we wanted to eat Chinese. I was a policeman, and I could finish work at midnight, and we'd shoot down Chinatown in Philly. And she says, oh, I want to get some Chinese food. Okay. And next thing you know, she says, I'm getting pains. So I says, come on, boom. We made it home.
Is it the baby or the Chinese food? You didn't know.
So she was born in Riverview Hospital, which is now Suburban. So now,
that's right.
Now that's great. I had the top person there, the superintendent, what do they call him? Suburban.
CEO?
Yeah, yeah, she was here.
That's right.
And a lot of advances there, you know.
That's
and
right.
they're staying there. They're not moving out.
Nope.
Thank God.
Nope, we're not.
Okay, so now, all right, now, you are a local girl, and you got your, where did you the internship?
I did my internship and residency, which internship is your first year after medical school. And then residency is when you choose what you're going to specialize in for your medical career. So I did my internship and residency in general surgery at Mercy Suburban Hospital. Oh. Then I continued on.
How long ago was that?
I graduated from my residency in 2006. And then I went on to Bryn Mawr Hospital, not too far away, and completed a one-year breast fellowship program.
Dr. Grafey, she said, at Montgomery Hospital.
That's
She's
right.
been there. I had her on the show here, and she has to do with, what is she?
She's a radiation oncologist, somebody that that discipline I deal quite frequently with.
You work?
I've worked with Dr. Grafey. I work with Dr. Tupchung, who's at the Powell Street Cancer Center as well. They both do the same kind of thing. I operate on the breast cancer, and then Dr. Grafey or somebody else who's a radiation oncologist will provide radiation as additional protection when we do breast conservation
Well, I got
surgery.
to know her because when I got prostate cancer, okay, so she treated me.
She took care of you, that's right.
Right. And then I had colon cancer, and another doctor took care of me. So I have a lot in common with what you're talking about.
That's right, that's right.
Now, do men get breast cancer?
They sure do. Anybody who has breast tissue can get breast cancer. Women have a higher risk because most of the time they have more breast tissue than men do. But
Why?
men have breast
Did they
tissue.
say why? Or
it's just an
was
anatomical fact.
The milk or anything had to do with it?
No, it doesn't. In fact, men can get breast cancer, and when they do, it's often found later because they, feel a lump. They think it's going to go away. They don't want to say anything to anybody. Sometimes it's a little sensitive subject for them to bring up with their physician.
It's the same thing with the prostate.
That's right.
It's
a private matter,
shame,
but
private,
there are things. There are
right.
doctors that take care of private matters. It's important to bring them up.
So, you operate on what is that? Is the operation the final last resort? Is
No, that's a good question though, Hank, because surgery is always a part of breast cancer treatment. But sometimes it comes at the beginning, and then I send the patient to a radiation oncologist or a medical oncologist who prescribes cancer-killing drugs or chemotherapy. Sometimes I meet the patient and send them to the medical oncologist first to give them some cancer-killing drugs before I operate on them, because it makes their surgery easier. It shrinks the tumor and makes their surgery easier.
That's strictly for the breast.
Yes, that's right.
You don't operate on anything else?
I don't. I trained as a general surgeon, so I used to take out gallbladders and appendix and parts of colons and things, but my fellowship, I focus only on the breast.
The gallbladder, that jumped to another thing.
Sure.
But they operate, they take you out to the belly button.
That's right.
What's
Little
the scoop
holes.
on that?
Well, I'll tell you what, that's minimally invasive surgery. That's the wave of the future. The less we can invade your natural,
In other words,
natural habitat.
cutting in areas
That's right. We make 3 little cuts. We use a camera. We can see things a little bit better, and we take the diseased part out through a little opening. You're up and out of bed quicker. You recover quicker. You get on to the rest of your treatment quicker.
Right, yeah.
We know it doesn't affect your immune system as much.
Yeah,
Absolutely.
Just last week, a friend of mine had terrific pains, and they took him to Chestnut Hill Hospital, and they had an enlarged gallbladder.
Yes.
And then, so then they check, and they said, now we got a tumor near there. I don't know if it's a tumor. They wait in about a week or two. They got to get some kind of biopsy to see if it's
Sure.
And then so I was so surprised that when I mentioned, hey, my friend, oh yeah, I had mine out. And my sister, my own sister, told me she had her gallbladder. I said, well, you never told me,
That's
well,
right.
She moved away, and
Right.
But there's a lot of people who had gallbladders.
Most of the time, it's because you have stones in your gallbladder. And if I told you to stand out on any busy street in East Norristown area, there's probably 20% of the people walking around have stones in their gallbladder.
Right.
But only about 15 to 20% of them have any symptoms or problems or what you call a gallbladder attack from them. Yeah, but we don't, if the gallbladder doesn't act up, we don't bother it.
What are some of the warnings of, now that I'm sure there's quite a few women watching this. I know that when I go to the supermarket and people stop me, oh, Mr. Cisco, I watch your show. Get more doctors on there. We want to talk about health.
Right.
I says, okay,
That's right.
And so what are some of the warnings that should be looked at? I know they say look for lumps and all, but is there anything else?
There is. There are many things. And, the truth be told, we know our bodies better than anybody. So, examining yourself once a month, and, men and women say, oh, I don't do that. I don't do a self-breast exam. When in fact, if you wash yourself, you do examine yourself. You got to run the soap over your body.
Right.
So
You rub
I knew
your hand.
that you got it. You got it. You feel a new lump, no matter how big or small it is, that's the most common finding. But there are other findings that are something that should be investigated, like a rash in the area of your breast or chest area. Could be underneath, could be on top. You look at yourself in the mirror while you're getting dressed and you say, boy, that looks like a bruise, or where did that come from?
Yeah.
Sometimes there's a discharge coming out of your nipple and you're like, well, that's not supposed to happen to me. That's not a normal thing.
Right.
Sometimes you look at yourself in the mirror and you say, boy, there's no rash, nothing hurts, but it looks like this side is way bigger than this side all of a sudden. Those are important warning signs that you need to tell your doctor about.
When in doubt, check it out.
That's right. That's exactly right.
In other words, look at yourself. Don't worry about the lipstick and the and all that there. Look at your whole body and see how you're developing. At 85, I just turned 84. November the 9th.
Congratulations.
And every time I look, I'm losing my hair a little bit. I got a little brown spot up here. Hey, 84. I can't complain.
Things change, but you can't stop looking. You're
I still
absolutely
eat
right.
spaghetti, ravioli, and so I'm still in shape.
Gotta have a good time, right?
Right. Now, how's a life of a surgeon? Do you sleep well at night?
I sleep well at night because I take care of only breast patients. And so what that means is a lot of people that come to my office are sent from their family doctor or their internist or their gynecologist, you know, for evaluation of something. Maybe they had an abnormal test. Maybe they felt or saw something. And they come to my office, and I will talk to them, do a history and physical. If a biopsy needs to be done, I do minimally invasive biopsy in my office. And I take care of only breast patients.
Okay, biopsy.
Yes.
Tell me, biopsy. What do you do? You snap a little bit of the snip, or what they call it?
There are a couple different biopsies, but if I were to classify them generally.
Biopsy, and he's waiting now almost a week to get a result.
That's, and it depends on the kind of biopsy. There are two general types. Incisional, where all we're trying to do is get a piece of the tissue to have the pathologist, the doctor who looks, not that small, but they look at cells underneath the microscope. And they want to see, do they look normal or benign, or do they look kind of ugly and angry like malignant, okay? That we only just want for diagnostic purposes, and we're taking just a piece of the area that's abnormal. If we do what's called an excisional biopsy, I'll tell you that we're aiming to take the whole area out that's abnormal. Incisional biopsies are usually done in the office or in an outpatient setting with just a little bit of local numbing medicine. You go about your way. If we're doing an excisional biopsy, most of those are done in the operating room where you have a same-day surgery. You go to sleep for 20 minutes and you wake up and you know, go home that same day.
How do you put them to sleep? Needle or?
Usually an IV, medicine in the IV, that's right.
And they just go to sleep?
They just go to sleep, yeah.
But you're awake?
No.
Can you hear?
No. You are sedated, comfortable, you can't hear or remember anything.
When I got operated on, I think I could hear the doctors were talking.
You might have had a different kind of anesthesia. Well, you might have had a spinal anesthetic.
It was my first time. I think it was an enlarged prostate, and they didn't remove it. It wasn't cancerous the first time, way back.
Right.
And I think it was Dr. Golden and then Dr. Perch, and they all retired. I started with Dr. Golden, he retired, and then Dr. Perch, he retired. Then Dr. Gottlieb, he retired. Now I got Dr. Rosenthal.
Yes.
I got all my lunchmen, you know.
That's right, that's
right. My Goombas. And, but I remember they were talking, they were saying, yeah, oh yeah, how you doing? Yeah, you're still in the police department? They were talking to me like, well, I wasn't answering anything, but I could hear them talking, you know. That's a different kind of anesthesia.
It is. It's a different kind of anesthesia. We usually use monitored anesthesia care, or MAC is what we call it, where we use a combination of medicine in the IV to make the patient comfortable and sleepy.
Yeah, relax.
As soon as we turn it off, we call it milk of amnesia because it's white.
Whoa, what?
Milk of amnesia, not magnesia. Milk of amnesia, that's right. We put it in the IV.
Boop.
That's right. They go to sleep. We turn it off. They wake up. It feels like you had a nice nap. Combination of that, and plus I inject some local, or kind of like what you get at the dentist when you get a tooth pulled. Kind of like Novocaine.
You know, what I remember, I was a former police officer, had juvenile, and this kid was always hooked in school. He would hook you on a Tuesday, and so at that time you could petition the kid if he hooked in school for so many days, missed so many days, they could petition the court. And here, when they sent the kid to juvenile court because he didn't want to go to school, then and here when he went to the juvenile detention, he wouldn't take his shirt off. He wouldn't take his shirt off, and they, when you go there, they want you to change it. But and here it turned out to be that he had enlarged breasts. He was just a junior high school.
That's right.
He had enlarged breasts, and then on Tuesday they had gym, and then he had to take his shirt off, and all the kids said, "Look at the boobs on him," stuff like that. And he was ashamed, and he would hook his school.
That's right.
And so I was. Thank God I was able to detect that whatever they did, they took care of it. They reduced them and all that stuff.
That's right.
So they reduced it. Now, you look at Hollywood, they're over there like that,
That's right.
What's the scoop on that?
Well, what you're
talking
about...
Is that a dangerous thing?
No, what you're talking about with that young man is very common in adolescence, during puberty, when their hormones are, off the charts. That's called gynecomastia. That's the fancy word for enlargement of male...
Wait, do that again.
Gynecomastia. Okay. Enlargement of male breast tissue. Okay. That's the most common time that it's found. And if you wait until the young man is through his, puberty stages and he still has residual tissue, then yes, we can do a surgical procedure where we can actually take out that enlarged tissue.
Take it out?
And through nice incisions, you know, that you don't ever see, he can go back to the beach, take his shirt off. It can happen in older men too. Some medications cause it.
Some guys want to go walk on the beach.
Yeah, but those are big
Tarzan,
chest
right,
muscles.
yeah.
There's a difference between chest and breast.
Yeah.
They sound the same, but they're different, right? When it happens in an older gentleman, I always ask for, you know, a certain kind of medications. There are certain blood pressure medications, medications for reflux cause it. Sometimes too much drinking. People that drink too much alcohol and get cirrhosis, they can get it. And people who indulge in marijuana smoking can get it too. Marijuana causes this gynecomastia.
Maybe
That's
if
right.
you puff this way and one will get bigger than the other, then what?
Well, that's what happens, unfortunately.
That can happen, right?
Yes, that's right. During puberty, usually young men have it on both sides. But when it happens at a later time in life, usually it only happens to one side. Yeah.
Now, you have you developed this, your passion for healthcare and breast signs of what? Tell me something about your passion for this here. You sound like very enthused and
I am.
you like what you do.
I
you know?
do. I do.
And,
I call myself a pom-pom shaker because I could talk about what I do all day long.
And you enjoy it.
My inspiration for getting into healthcare, I'm the first person in my family to become a physician.
Tell me something about your family.
I have one brother who still lives near my hometown. His name is Michael. He's married.
In Allentown.
That's right. He lives in Zionsville, which is near Emmaus, not far away. I have.
What's he do?
He's a graphic artist.
Oh, yeah?
He has his own business in Telford. Not, you know, we're all kind of
Telford.
located. Yeah, we're all
Little
located.
country girl, right?
Yeah, that's exactly right. My mom is still with us, and she lives in Allentown, 5 blocks away from the home I was raised in. But she downsized and lives in an apartment now. And my father, unfortunately, passed away 21 years ago,
Wow.
Sunday, on Veterans Day. Yeah.
Oh.
He had Legionella pneumonia, believe it or not.
Legion,
That's
that
right.
they got
that
down there at the
Legionnaires,
Bellevue Stratton.
yeah, you got it. So
How about that?
between his health, my mother who's had frequent back surgeries, and my father, my nephew, and my brother, so father, brother, nephew, all have a rare sort of bone cartilage cancer that they think is an inherited kind of thing on the male side of my family. I was around hospitals and listening to doctors talk all the time when I was young. My brother's 11 years older than me. So I kind of got interested in medicine and healthcare and listening to all these big words.
When you dropped the seed, were you in high school or somebody influenced you?
Yeah,
or?
you know what? It was. I probably became interested in high school and went to Penn State and worked for 4 years in between college and medical school so that I could pay my undergraduate loan bills before I went on to medical school. So it was really kind of my family's experience with illness that got me interested in healthcare. What got me interested in breast disease was my program director, who is Michael Shore at Suburban Hospital.
At Suburban.
That's right. He trains all the surgical residents there. He said to me, Lori, you're a woman and you're in surgery. No matter what you decide to do when you're done, you should get some breast experience because women are going to want to come to you because you're a woman and it's something that, you know, you feel a kinship to. So right after he said that, Tom Frazier, who's a breast surgeon at Bryn Mawr, who runs the fellowship program there, came to lecture at our hospital at a grand round session for all the interns and residents. I introduced myself to him, asked him if I could spend some rotation time with him. I spent 2 months in his office, and I don't know if I picked it or it picked me, but that was it.
And that set the
That's
fire,
right, that's right.
That set it off.
That's exactly right.
But you strictly breast cancer.
That's right. I take care of benign diseases. There are a lot of things that aren't cancer. You know, when a woman comes to me and she says, I have a lump, she doesn't necessarily know if it's cancer or not. We need to find out, and I take care of a lot of benign
What do you
things.
do? Okay, the lady comes here. What do you do?
I
Now,
do
you
it.
brought some charts here. Do
That's
you wanna
right.
reflect
That's right.
this? Just
Well, first of
comment
all,
on-
the anatomy chart, which is the first chart that I brought, in the simplest sense, and contrary to the popular belief of Victoria's Secret and Sports Illustrated, our breasts were put on our bodies to feed our young.
Oh,
So there you go. There you go.
there we go.
But they're composed of two
Yeah, what the
primary
Hollywood's using for
units.
everything
They don't-
else.
They don't get it either. You're absolutely right. But there's two main parts to the breast: the lobules, which make milk, and the ducts, which deliver the milk to the nipple to feed our babies. 85% of all breast cancers happen in the duct, started from the duct. 10% are lobular in nature, and the other 5% are kind of like your weird relative, the one that never shows up at any of the family reunions. They're odd, they're unusual, and you're happy not to see them frequently, and they don't show up frequently. Things like mucinous carcinoma, sarcomas of the breast, those kinds of things.
And then,
So a woman comes into me and she has a lump. Now I'll ask her a history, her age. Has she had anything like this before? Has anybody in her family had breast cancer or ovarian cancer or melanoma? Because those are all the same
Right.
kind of precursor cells for breast
Right, right.
cancer. I ask, have they had a mammogram or an ultrasound? And if so, we look at it, and was it normal? But if a woman comes to my office and she says, I have a lump, I don't care if she hasn't had a test. If we have a lump, I can do an ultrasound in my office and have a look at it.
Oh, yeah.
And I can do a minimally invasive biopsy and take some tissue from that lump. I have an answer in 24 to 48 hours.
wow.
That's right. And most of the time it isn't anything. But it makes us
But at
all
least
sleep a little bit better.
Makes you feel better.
That's right. That's
I know,
absolutely
right?
right.
In fact, I just had a check for my colon with Dr. Frost.
Yes,
He's
yes.
the one that operated on me. That took about that much.
I trained with Dr. Frost as well. That's right. He comes to Suburban and operates as well.
Yeah, and in fact, I got to take in January. I got to do colon. How do you say it?
Colonoscopy.
Yeah, oscopy, whatever
Yep.
it is. So I'm going to have him on my show.
Good, I
And
think that's
They
great.
take pictures of that.
They do,
Then
they
maybe
do.
I can show them pictures of my. Right?
That's right. That's right.
Yeah, I'll do that. Right. Now, who was that movie? No, TV. She did it on Channel 3.
Katie Couric.
Yeah,
yes,
she did it.
because
the
her
whole lot.
husband passed away from colon
Yeah,
cancer. That's
right,
absolutely
right,
right.
right.
Do you know colon cancer is virtually 100% preventable?
Preventable.
Preventable.
Why? How?
Because if everybody had their colonoscopy and their digital rectal exam at the time when they were supposed to, meaning if they have a family history of colon cancer, and they had a brother who got it at age 40 and a sister who got it at age 42, you should start your screening 10 years earlier than that with your digital rectal exam and your colonoscopy. If you have a good look, doctor takes a look, sees a polyp, and removes it. If we could get rid of all the polyps, we wouldn't develop colon cancer.
Yeah. I
But
think-
people don't, it's not
yeah,
it's not a glamorous process.
The first time I had that
That's
colon
right.
thing, they removed it. The doctor come out and says, "You got a couple of polyps. We removed them."
Right.
I said,
And
"Good,
that's
okay."
usually what they do.
Then the next time I did it, he said, "Well, we got some cancer, so we got to cut it out for you." It's okay.
That's
Do what you
right.
got to do. So, I don't know. Okay. What else? What? It's on the front burner for technology as far as women today.
Well,
give me something to remove some of the fears of women. The best fear is to get examined. Get rid of that fear.
The first thing is not to be afraid. If you see something or feel something, by all means,
Don't panic.
Don't panic, because chances are it isn't anything.
Right.
And if it is something, there's something to be done about it. Years ago, we thought, oh my gosh, breast cancer. I knew somebody who had breast cancer, but
right.
they weren't cured. They weren't cured. And the cure was an exception, not the norm. That's not the way it is today.
right.
The earlier we catch it, the better off we are. That's why we do screening tests. Screening tests, the examples of a screening test are your self-exam, the breast exam you have from your primary care doctor or a breast specialist like myself, and digital mammography, a mammogram, where you go to the radiology suite, you get that once a year, every year after the age of 40. Once a year.
Once a year.
That's right. We compress your breasts and we take a look at them. It's once a year. It's not that painful, and it's that important to catch.
You had
something
another
very
chart
early.
there. Can you briefly just tell me something
That
about the second
explains a
chart?
lot about the breast self-exam. Same time, once a month. There's the screening test that we talked about. the digital mammography every year, checking yourself once a month, and going to your healthcare practitioner at least once a year. And you need to make sure not to be afraid.
Right.
If you have any questions, I have a website, and you can reference my card. It's lcenterforbreasthealth.com.
Okay.
And you can look there. I've got some information if you have
see if we can
access to
put
the
that
internet.
on the screen.
That's right.
Well, you know what? The half hour shot.
I can't believe it.
A half hour.
Went by
Okay.
fast. Absolutely.
You know, and so it's been a pleasure.
Thank
I'm telling you, I learned
Thank you,
so
Hank.
much, and
Thank you for having me.
Right, ladies and gentlemen, it's so wonderful to hear someone tell it as it is, and as it is, and as I experienced most of the things. I don't have any breast cancer, but I had bobbing and weaving someplace else. So I just appreciate that, and I just want to give you a little something here. It's thanking you for coming on my show.
Thank you
And
very much.
It's actually, we're on channel 28 now.
All right.
Comcast, Monday, Wednesday, and Friday, 5 o'clock, Saturday, 2 o'clock, 2 p.m.,
All right.
and then every day at 12 noon.
This'll be
So ladies
great.
and gentlemen, how about it? No nudity, no profanity, strictly stuff to keep you happy, keep you healthy. So until we meet again, and we say Allah Zalud to your health. And this is all water, okay? I think we covered it.
Who brought the pizza?